Phoenix. Hi, everybody. Thank you for coming today to our CoLab Presents presentation. Today, we're having one of our CoLab team members present today, Phoenix McGreevy. Excuse me, I messed it up again, even though they gave me an update before. Phoenix will be giving a much better introduction to themselves now. Thanks, Phoenix.
Well, actually, Corey is supposed to introduce me and read my bio.
Oh, okay.
I'm getting
if Corey has it, let's do it.
I would be happy to. Hi, everyone. I'm Corey. I use he, him pronouns, and I'm a registered nurse, and I'm the research manager at CoLab. And I'm joining you today from the unceded territory of the Cowichan tribe, which is what is colonially referred to as Duncan. I'm super pumped to be listening to Phoenix and to be listening about this excellent work that they've been doing. And I'm really happy to say that I can pronounce Phoenix Beck McGreevy and can give them an introduction that Phoenix is a queer agender settler gratefully inhabiting the unceded territory of the Coast Salish people since birth. Having spent more than 2/3 of her life as an active drug user, Phoenix is dedicated to improving the lives of other substance users and all marginalized and oppressed communities through research, mutual aid, and direct action.
Alrighty. So just a little bit about the presentation. So the purpose of this paper is to outline a framework and methodologies and other related processes for respectfully and meaningfully engaging and partnering with people who use drugs, both Indigenous and also settlers and other residents in research that directly impacts their lives. So in this project, people with lived and living experience of substance use held roles as research associates in the evaluation of a prescribed safer supply under the risk mitigation guidance prescribing under the dual public health emergencies, both of COVID and the overdose crisis or the drug poisoning crisis or the toxicity. There's 100 different words for it. So these are the observations, reflections, some of the lessons that we've learned, and some advice for research teams who want to work in partnership with people who use drugs. And this is a list of our peer research associate team. You can see the paper for a full listing. And I'm here today representing the broader research associate team. Next slide, please. So we dedicate this presentation to all of our fallen comrades, but particularly to Benjamin Stevenson, a very dear friend of mine and a valued member of our team who started with us and who will be dearly missed and remembered forever as we do this work. Thank you, Ben. Alrighty, let's jump into it. Next slide, please. So the peer research associate role was developed and evaluated in partnership with peers, with us, again, to build meaningful and professional positions for people with lived experience of substance use within the research. So in the risk mitigation guidance study, academic researchers partnered with the Peer Engagement and Evaluation Project, known as PEEP, and the BC Yukon Association of Drug War Survivors, which is how I came into the role, to develop the peer role and to hire peers as part of the study. So we were involved in writing job descriptions and interviewing staff. And so we played an integral role in hiring and bringing on other people with living experience. At the onset of the study, we specifically developed two peer research associate working groups whose members were people who used drugs or had used drugs. In order to guide primary data collection, we formed two groups. One is a province-wide table of Indigenous and non-Indigenous people who use drugs, and a smaller, more Northern and Indigenous focused specific group. Next slide, please. So from the start, peers are positioned as partners. We help to develop and evaluate the role within a research project. So again, this paper is specifically about the role. It's less about the research than it is about the specific role of peer research associates and how that how that went and how it started and what we learned from doing that. So true involvement for us meant prioritizing peers in the development and the evolution of the role. So we wanted these positions to facilitate meaningful engagement and not to be like pet peer or tokenizing. And so the pet peer problem is where, you know, there's one or two people who use drugs or people who more commonly used to use drugs who are frequently brought into a lot of different projects because they're neat and they're easy to work with and they don't have messy, chaotic lives, and they're the pet peers. They're the teacher's pet of the peer work sort of field. And I'm sure a lot of you can identify with having encountered some of those types of folks. So we didn't want that. We didn't want the same faces over and over again. So we really strove to find whose voice was missing from the table and make sure that there's representation from a lot of different diverse groups. And I feel like we've done a really good job of doing that. We also wanted to make sure that peers were viewed as partners in the research, making room for omnidirectional learning, like in a meeting, if somebody doesn't understand what an academic team member says, we can say, hey, what does that mean? But we can also, there's also room for the academic to learn from us as well, which is what I feel makes this a really critical difference from many of the other advisory groups I've been involved in. And just a note on the name, the peer research associate, that term was chosen by us because we felt that calling us associates means we're not assistants or advisors. We are professional and equal partners in the role. Okay, come on, Moo, I'm busy. Go away. Frickin' cat. All right, awesome. Next slide, please. Yeah, you can just go ahead and show them all. All right. So, there's numerous guidelines and research standards recommending involvement and engagement of people with lived and living experience of substance use in policy and research that affects them. And so the Wellesley Institute identified 3 potential models for peer involvement: advisory, employment, and partnership. And so drawing from existing collaborations with PEAT, BC Yukon, CSUN, Coalition of Substance Users of the North, and First Nations Health Authority peer networks, we held roles as project partners, advisors, and had opportunities for employment of advocacy. So speaking on this 4th role of advocacy, we added that to this model, identifying that it is more than employment rather. There's an additional layer of getting information and building a skill set that we can then take back to our communities to advocate for change and to advocate for influencing change. And without the advocacy piece, we didn't feel that it was fully community engaged and community-centered research. Being able to use the research findings to advocate for our communities is a key motivation for why many of us chose to become involved in this. And we're part of creating evidence that can be used and applied to improve safer supply policy and programs. So it's more than just being paid to do something or, you know, having our names on things or anything like that. It's really about taking what we learn here and taking what we help create the learning and bringing that back to our communities and sharing that. So advocacy is a really big part of why a lot of us are doing this. Next slide, please. So we took different tasks and roles in the project depending on our time and our energy as well as our interest and skills. So some of the peer research associates were really interested in recruiting, in doing eligibility screening, in scheduling interviews and doing that sort of thing. And it was really tailored to each of our skills and strengths. Some of us were more interested in more intensive involvement with data collection, data analysis, findings, sharing findings, doing knowledge translation through presentations and speaking engagements. Initially, when I started, I was just doing recruitment, so basically engaging in snowball sampling, going out to my community, finding people who I think would be a good fit for the qualitative the quantitative research, the quantitative surveys, going out, finding them, bringing them in, doing the data collection with them and then paying them. But it turned out that given my previous experience with research and just my strength as a person, I was better suited to things like writing this paper, doing speaking engagements, and sharing findings, and sort of being a bit of a spokesperson for the peer team and supporting the other team members who wanted to do speaking engagements and things like that. So really making sure that we were tailoring the available roles to the people. Hiring people that we thought were superstars and hiring people that we thought were gems, and building the role, the peer research associate role, around them and around their strengths versus hiring somebody who's just a cog in the machine that can be, transferred out. The other really important piece about flexibility in this role, which flexibility and adaptability was the number one main the main thing that we learned, the keystone of the whole thing, is being flexible and adaptive towards the people that you're engaging. So the other piece of that is prioritizing mental and physical wellness. We realize that circumstances can change, that may impact people's ability to engage in the work. We made space for people to take space when they needed and to return to the role when they felt ready. There were opportunities to take space for physical and mental wellness with no consequence to the role. If somebody needed to step back for a few months, they knew that their position was still waiting for them when they got back. And we managed this by making opportunities to shift responsibilities within the group to meet changing capacities. So if somebody who was doing a lot of great recruitment in Vancouver Coastal Health had to step back, there would be another person who would be able to step in and do a little bit more recruiting in that area to make up for the shortfall. It's just really, this is very cliche, but it's really just about teamwork and adaptability and really looking out for each other. Yeah, and just building towards people's capacity and their bandwidth. Like, sometimes I just want to turn my brain off and stop answering my phone. So I just let them know that I need to do that, and I stop answering the phone and I stop doing emails and just kind of drop off for a little while because, this is a very stressful life, whether you use drugs or not. It's really hard to be an alive, compassionate, empathetic human being right now. So sometimes we just need to step away. And it helps to maximize on strengths, building these roles to be so flexible and adaptable. Next slide, please. Unfortunately, my colleague was not able to join us today. So I'm going to take this slide on culturally safe research, So we come to this work with the understanding that there is an intense, disproportionate amount of harm and number of deaths affecting Indigenous people and their communities from not just from the toxic drug crisis, but from all the way back from the start of colonialism to today. The harms and the shit from drugs and drug policy that is harmful is falling on Indigenous communities far more than it is on other communities. So understanding and recognizing this, our team is committed to working towards decolonized, respectful, and reciprocal methods of engaging with Indigenous participants, as well as research associates and staff, and to create a work environment that fosters cultural safety and humility. at the onset of hiring, First Nations Health Authority engaged with networks of Indigenous-driven harm reduction organizations to find potential candidates, and Indigenous people's lived or living experience from the northern region were involved in all aspects of the project to provide peer support. For instance, if there was even though quantitative research, as I'm sure many of you know, is a little bit less intensive sometimes than qualitative, just given that it's less about the person telling their story and more about just like answering a survey with set answers. There can still be really uncomfortable stuff in there. There can still be a lot of triggering and uncomfortable discussions that can be brought up by some of the survey questions. So we had, excuse me, Indigenous peer research associates who were able to provide peer support with each other if they had to go through an uncomfortable survey, if there was just a particularly difficult meeting or call or things like that. They were also able to help interpret data and findings and ensure that Indigenous lived experience of substance use was always respected and centered. Excuse me, one moment. Pardon me. And for this most recent phase of the project, we have been incredibly lucky to have Elder Dorothy brought into our fold as a knowledge keeper, and we have been benefiting from her wisdom and just from her gentle energy during our peer research associate meetings. She's been helping to keep all of us, even the settlers, grounded, and it's like having an auntie on call, which is quite wonderful. And just to bring it back to methodology, there are standards and guidelines in Canada and some recommendations from Indigenous substance users about involvement of Indigenous people in research that affects them. There's still a lack of guidance and framework for researchers, so that's really a big part of what we're hoping to do with this paper, is to provide a little bit of advice and education. Next, Slido, please. So one of the other things that made this role really work was the provision of resources to support accessibility and address barriers to involvement. For instance, when working with people who use drugs, there's also a large part of those people who are going to be either homeless or living in poverty without a lot of access to technology. There's an awareness on the team of accessibility for different working environments, whether that's through language, through technical support, through support for rural or remote team members. Every month, we receive a $50 stipend for data and Wi-Fi costs. There are, as I was just saying earlier, laptops, tablets, headphones, whatever we need technologically is lent to us by the University of Victoria. Thank you, UVic. There's also a lot of technical supports and troubleshooting. We have a dedicated, IT person from UVic who is very helpful with sorting things like that out. Because we want to make sure that no matter what your level of comfort with technology is, that you can participate, in whatever your level of housedness or lack of shelter. Which is because it's been a bit of a problem, because we have had some of our peer research associate members who are living in the downtown east side, either in shelters or in SROs. Their devices have been stolen. There's been a lot of problems with that, but it's just something that we sort of need to just accept is going to happen if we're going to be working with this population. And I mean, it's a laptop versus, the value of a laptop versus the value of having someone's voice. And to me, it's not a comparison. We also are there's a lot of discussion about what individual needs people had for different working environments, whether that's Zoom meetings, in-person work, traveling for conferences, etc., such as like making sure that people are safe if they're using while they're away for a conference, or whether they're using at home with their camera off during the Zoom call or things like that. Just making sure that there's support and safety available in all of these working environments. And for me, the most important and critical thing has been reminders for meetings and regularly scheduled check-ins. There's a dedicated point person with schedule flexibility who can answer questions and support, stay connected, and help tailor the role. Sends reminders, is approachable, and responsive to the diverse needs of the team. It's amazing. Just having that person that I know I can ask them anything. I know they're going to text me the day before a meeting, because if it's not in my calendar, sorry. There we go. Car alarm. Okay. So yeah, having that person that can help with scheduling, because honestly, like if it's not in my calendar, I'm not going to know that it's happening. You can remind me 100 times, but having that calendar reminder, having that person being like, hey, come on. So it may cost more in a personnel and time sort of way, but really like just making sure that you have the flexibility to have these resources available is going to improve your data. It's going to improve your team. It's going to improve your street cred. There's just, it's, it's a win-win. Next slide, please. Oh, yeah. So, as well, this was something that my colleague was going to tackle, because unfortunately, I don't know what it's like to be working in a remote context with this project. So I'm going to just have to pass by that one. Next one, please. So we come to the meat of the issue, equitable pay and flexible compensation methods. So, as I like to say, drugs are expensive when we live under capitalism. And unfortunately, that's just the nature of the game. And while it would be nice to just be able to just do lots of great things for your community and engage in these sorts of roles and jobs, because it's going to help the people that you care about, unfortunately, we can't do that. We need to be paid, because our time is valuable, and we live in a world where we have to pay for the most basic of things. So it was decided that pay should be equitable to other research positions on the team, and we identified that pay should be equivalent to a graduate level research assistant. So that is what we are paid, the same amount as a grad student. The compensation obviously should align with the time of work, but more than that, it should be paid out in a timely manner. Many of the peer research associates on the team are paid at most weekly, most often within a few hours of doing the work, by submitting a timesheet and requesting pay by e-transfer. Because I'm in a more full-time role with the project, I'm on payroll, which sucks and I hate it, because I run out of money way faster than 2 weeks, but that's okay. That's just me. We've also developed protocols for payment for conference presentations, both virtual and in person. And conference organizers should take into account that if they want people who use drugs to participate, they should ensure that there are scholarships or other ways of compensating them if available. So not just for presenters, because most conferences and organizations will pay you for speaking, but just to have people who use drugs and people with lived experience and people living in poverty, to have them there to bring the other side of the discussion, whether you pay for that or not. Like there should be scholarships and things like that. There is also a lot of value in offering alternative methods of compensation. For example, using e-transfer instead of payroll for people who don't have a bank account or who are in need of the money faster. This project was also unique in that it was able to get an exemption letter for the Ministry of Social Services and Development or whatever. So basically, our folks that are on income assistance, are on disability, or on social assistance, they don't have to count this as wages earned, which would then lose them that money the next month when their welfare check comes in. As I'm sure many of you know, if you are on disability or on welfare, if you earn money over and above a certain amount, it gets taken back by the government. So we were able to obtain an exemption from this, which is quite amazing and really helps to ensure that our participants who are still really vulnerable and really living in poverty and are on social assistance are still able to participate without losing. As well, in terms of the participants in the research, not just the peer research associates, very early on in the discussions, when the project was still being planned, there was a lot of talk about paying people, remunerating them for their time doing the survey with gift cards, and a bunch of us stood up and said, no, that's fucking bullshit, let's not do that, can we give them cash? So the academic team leads and the leadership listened to that and took it back to the ethics committee, and we were actually able to give out cash, either cash in person or by honoraria, or cash honoraria by email transfer, in order to eliminate the gift card thing, because it's infantilizing and it just feels really like it feels really dehumanizing. It's like, well, we can't give them money because they'll just use it to buy drugs. It's like, well, the reason that you want to talk to them is because they buy and do drugs. So what's up with that? And $20 at Tim Hortons or London Drugs is not, it does not have the same value as a $20 bill. So that was that was an early indicator of how valued our voices would be, and how having the actual people that from the community that you're trying to engage in research at the table can really improve your research methodologies. Next slide, please. And so a lot of this comes down to recognizing us as experts. This is a space where we're seen as more than just our horror stories, more than just the hardships we've experienced. This is a place where our lived experience and knowledge are highly valuable. And everyone on the team, including the academics, adds value to this experience. I don't want it to seem like I'm saying like, oh, well, we're the shit, and the academics can just go, go stand out in the field. Like, it's about the team. It's really, as I said before, about the omnidirectional learning. The academics have provided a ton of mentorship opportunities, and the value that this mentorship has provided cannot be overstated. Providing professional references, personal and professional advice, support, constructive criticism, all of this is building the peer research associates into better research associates. We also had opportunities to build skill sets and gain credentials and recognition. Some of the federally, some of the like concrete recognition and credentials include the TCPS2, which is a federally recognized ethics certificate, which is transferable to other research projects, as well as opportunities for to do presentations and speaking engagements, to influence change, to build our resume, and to build professional status in the field. So it's really about teamwork and about making sure that everything goes in both ways. And I just have to say personally that this is probably the best work environment that I've ever had, and the most valuable experience that I've had. And that's it. That's my presentation. Questions and answers.
Wow, thank you so much for that, Phoenix. Really appreciate it. So I'm going to turn off the recording so that we can have a more fulsome discussion.